Checkpoint can reveal a nurse at Christchurch Hillmorton Hospital has been left scarred for life following an attack by a patient earlier this week. The nurse was working in a high care area in the adult acute inpatient unit at the hospital where a patient threw boiling water over her. She was rushed to the emergency department with serious burns. Our South Island reporter Logan Church has been covering this issue for some time and joins us now live. And just a warning, if you are watching, the photos of the nurse's burns are graphic. Logan, what can you tell us about what happened?
Hi Lisa, well what we know is that this nurse was working on a night shift in a high care area in the adult acute inpatient unit at Hillmorton Hospital. Now these high care areas are pretty much what they sound like. They're supposed to be used to look after patients who need higher levels of care. But what happened this time was that a patient had a cup of boiling water in their hands and for whatever reason decided to throw it at the nurse. And as the pictures we've been sent show, it left horrific second-degree burns over the nurse's body. And those burns cover much of their left arm, left shoulder, and the left side of their chest. And massive blisters can also be seen. Of course, now those wounds have been bandaged up. Now the entire left arm, shoulder, and chest are covered in white bandages. Essentially, this nurse will be left with scars for the rest of her life. And sources in the hospital told me not long ago that the nurse is now on ACC leave.
Gosh, those pictures are horrendous. Why are assaults such a big problem at this facility?
Well, we've reported on this issue for some time, and I've been told by both nurses and the CDHB that there are a few contributing factors. Nurses inside the hospital have repeatedly told me that staffing is a big problem. Many senior staff have left the facility, and that's left young, often female nurses, left dealing with patients who are often aggressive and often, sadly, men. The facility itself, 64 beds, isn't big enough to cope with demand as well. Having 90 patients in there isn't that uncommon. And we, of course, know that mental health is a big problem in Christchurch in particular, and this place is really the ambulance at the bottom of the cliff for that, so to speak. Nurses say the actual design of the facility isn't helping. Those high care areas where this incident happened has been described to me as very dangerous for staff. The actual layout consists of a common area with rooms and an office of it to give you a picture. And when nurses feel unsafe, they can lock themselves in the office, but when they do, there is obviously no means of escape and are reliant on an alarm system to alert other staff. And finally, there is a lack of security staff here. Unlike ED, on the other side of the city, there aren't security guards in these areas of high risk. There are guards now on site. After Checkpoint started reporting on these issues, a security guard was put in place, but not in the open wards or the high care areas. Instead, they were put in the low stimulus areas, which nurses tell me hasn't really been much use to anyone. Then, of course, these security guards can't actually restrain a patient until after someone has been hit. Now, just to be fair, there are different thoughts on the pros and cons of security guards, but essentially lots of contributing factors to serious incidents such as the one we've seen this week.
Thank you for that. That is Logan Church updating us on the situation at Hillmorton Hospital where a nurse is faced with permanent scarring after hot boiling water was thrown over her. Checkpoint contacted the Health Minister David Clark's office for comment. It referred us to the DHB saying that it sounds awful, but it is an operational matter.